Welcome to the Women in Wellness podcast. This is your place to get the latest up-to-date health and wellness information specifically for women, while providing you practical tools you can implement today. I'm Dr. Caitlin Sazowski, and I wanted to personally thank you for spending part of your day with me. Hello, Women in Wellness Tribe. I am beyond ecstatic about this conversation that I'm going to have with this amazing doctor, Dr. Ellie Campbell, because she is a doctor speaking to my own passions and interests, and I am just ecstatic that there are other doctors looking into the mouth-body connection. So just to give you like a little heads up on Dr. Ellie Campbell, and remember, you can always read her whole bio in the show notes. She is a board-certified family medicine and integrative holistic medicine practitioner. Smart lady with a specialty interest. I already gave this off to you guys in the oral systemic connection. Woohoo! And she is also amazing, absolutely amazing at interdisciplinary collaboration, which has to happen when you are looking at truly getting to the root cause of the problem. So welcome so much. Thank you so much for being with me, Dr. Campbell. I am so elated to have this conversation with you, specifically on how the mouth could be affecting overall women's health.
I am so happy to be here because, like you, we don't find that many of us out there. And to be connected with our interests is a rarity. And I would love to share some of my tidbits and words of wisdom with your audience, because I've been doing this a long time, 30 years in practice now. And 15 of it specifically dedicated to integrative wellness. And you cannot really discuss integrative wellness if you don't include the mouth. I don't know where in medicine the ivory tower people believed we could cut the head off and have the dentist do one part and the medical doctors do another part, and they didn't have to talk to each other. Because the more I learn about the ways that the mouth affects the rest of the body and the mouth affects the body affects the mouth, the more we have to learn about ways we can alter each for the benefit of the patient.
Oh, I know. So, isn't it crazy?
It's crazy.
Why do we think all of a sudden, like, our circulatory system, our lymphatic system doesn't play into the health of our mouth, and how the health of our mouth will not affect the rest of our body? I don't get it. It doesn't make any sense. And
especially the interventions that the dentists do on our mouth, how could they not affect the rest of our body? For example, me, when I was a teenager, it was standard of care to pull 4 perfectly healthy teeth to do orthodonture, right?
Oh, me too.
We pulled out 4 teeth, and then what did we do? We pulled the entire jaw backwards. We even made us wear headgear to make sure that we got that retropulsion of that jaw to pull everything backwards. What do you think that did to our oral airways as we were growing up, right? It shrunk everything. No wonder we have this epidemic of sleep apnea in people my age. I just turned 60. So don't you think that some of this shape of my jaw, which is now too small for my face, was caused by my orthodontist way back when, 45 years ago, who thought he was doing a good thing for me. He was following the best evidence of the time. They thought they were doing a good thing to give me a nice straight bite, but they had no idea the future ramifications of what they were going to be doing. So I see this over and over in my practice of other things that dentists have done to ladies especially, that now is affecting their health later in life.
Oh, they did that to me too. They absolutely did that to me. And now in my, I guess I'm mid to late 30s, I'm undoing it. So I'm expanding my jaw again. I'm making room, because there's no room for your tongue in a small mouth. And when you remove teeth, your jaw gets even smaller, which then forces more airway issues, and not to mention problems cleaning your teeth and everything. It's just crazy.
Right. They may be straight, but they're not functional. Mm-hmm. And so this is why we have to have a whole army of educated dentists to know and recognize this, because unfortunately in dental school, the emphasis is on drill, bill, and fill, right? and drill, fill, and bill. And when that's a wonderful way to make a living. And yes, dental cavities is a serious problem, but there's so much more to the oral cavity. And it takes a really passionate dentist who wants to understand how to modify and improve the patient's oral health for their benefit of their whole body.
I always explain to people, dentists are the same as every other type of doctor. If they don't go above and beyond their initial set of education, they're only functioning at the level in which they were taught in school. And unfortunately, no school actually teaches the overall systemic connection between everything. If a doctor wants to learn that, they have to take the time, the effort, put the finances together in order to fully understand and have a more comprehensive understanding of how to look for it, how to diagnose it, and then how to create a program to address it. So we got to be more mindful of the dentists that we choose, 100%. So what is it that you're seeing with women specifically that they're struggling with, whether it be, let's start with cardiovascular, because you actually told me something that I didn't think was true. And then I looked it up. But the number one killer of women and how that relates back to the mouth.
Yeah. So the number one killer of women is, if you fill in the blank and you ask everybody at a party, they'll say breast cancer. They're wrong. The number one killer of women is cardiovascular disease, heart attack and stroke.
That blew my mind. I was like, no way. I knew it was up there, but I did not think it was number one.
Right. And so here we are in February. This is National Heart Health Month. So if I can teach your lady patients to pay attention to their hearts this month and always, we can have a huge impact. Part of the reason why cardiovascular disease is the number one killer of women is because our tests aren't ideal for women's hearts, and I'll explain that in a minute. And our suspicion for heart disease in women is lower because in medical school, we're trained to look for signs and symptoms that are classic in men. They're not classic in women. So that crushing chest pain of an elephant sitting on your chest and breaking out in a cold sweat and nausea, those don't always happen in women. In fact, they rarely happen in combination in women. When we have a heart attack, we get this symptom. Something's not right. I don't feel good. I can't quite catch my breath, but I don't feel good. I don't know what's wrong, but something's wrong. That's the symptom of a heart attack, for crying out loud. Who's going to call 911 for that, right? When a man is on the floor sweating profusely and clutching his chest, everybody calls 911 for that. So we present differently. And furthermore, when women have heart issues, many of our heart attacks happen in much smaller vessels. And so when they do complete a heart attack, they don't damage as much of the heart. It's still a heart attack, but not as much of the heart is destroyed by that event. And so the symptoms are milder, the vessels are smaller, and they're harder to identify on our standard battery of tests, which include an EKG, a stress test, and an echocardiogram. Very often, those are perfectly normal. And when we do that battery of tests on women, and they come up all perfectly clear, the doctor pats them on the shoulder and says, "You're in great shape. There's not a problem here. We'll see you in a couple of years. You're fine." 11% of those women go on to die from cardiovascular disease after having a perfectly normal battery of cardiovascular tests. Is there a workaround? Well, medical science is working on it, but there's two things that women can do to be empowered with information that they don't know about. First thing, carotid ultrasound test, specifically to measure carotid intima media thickness. So what does that mean? If your carotid artery is a blood vessel, it has a little ring of muscles that go around it, and the thickness of that muscle wall is defined as the intima to the media. So how thick the muscle wall is around the artery, and the blood flows in the middle. Cardiovascular disease and carotid disease are the same disease in two different places. Well, we can measure just within a few millimeters of skin, we can measure how thick it is here. So we can track and monitor our program to see if it's working by measuring the thickness of this ultrasound test of the artery over time.
How
And
often should that test be done?
How often? Initially, we do it at 6-month intervals, at month 0 and month 6, and then about once a year thereafter until it stabilizes. Once it stabilizes and it's normal, we don't need to check it so often. But in my practice and in many practices who are trained like I am, we see reversal of atherosclerosis plaque. The hardening of the arteries gets smaller, right? Mm-hmm. And so that empowers patients to make changes when they can see on the test, oh, I used to have the arteries of an 89-year-old at age 45. Now I have the arteries of a 65-year-old. And in 5 years, I have the arteries of a 40-year-old, and my birthday's caught up. So now I match. Mm-hmm. So now I'm not in danger anymore. When I had the arteries of an 89-year-old, I was at serious risk for a stroke. Mm-hmm. And the same disease happens every place. We're just measuring an inch of it right here. So that's one test that you can do. The second test is a blood test, and it's a suite of blood work that we call the FIRE panel, because it's a misunderstood fact that cholesterol causes heart disease.
Oh, thank God you said that.
Right? Cholesterol does not cause heart disease. Cholesterol is good for you. Cholesterol is what your cell membranes are made of. Cholesterol is what your hormones are made of.
Your brain.
Right? Cholesterol is what your brain cells are made of. And so we have to have cholesterol, and it doesn't cause disease. The people who live the longest have the highest cholesterol.
So are you saying you don't want to be on a statin to reduce your total cholesterol to below 100?
Okay. Probably not. And this is the thing is that statin drugs are the angel and the devil in the same dang pill. And when they drop cholesterol below 100, then the patient doesn't have enough substrate to make the cholesterol that their brains and bodies need. But some people have such severe vessel disease that we have to make a choice between saving their life and reducing their cholesterol level. And sometimes, not very often, a couple percent of the population, we have to use a statin drug for that purpose. So the answer is never one thing, right? Every patient's different. We take every case individually. But if we have to drive their cholesterol below 100, they dang well better be on some hormone support, right?
Yeah, because you're not making them at that point.
You're not going to make them at that point. And we need to supplement their thyroid, adrenal, and sex hormones as well.
But the likelihood or the number of individuals that actually need their cholesterol to be most part dangerously low is very minimal.
It's very small. Mm-hmm. And another thing about statin drugs that I think is important to realize is that if we're using statins to lower cholesterol, we're using it for the wrong thing. That's not where statins have their benefit. They don't have a benefit so much because they lower cholesterol. You can use cholesterol to tell if the patient's actually taking their medicine. That's what it's good for. But we use statins for what we call the pleiotropic effects. They act as blood thinners. They stabilize inflammation. They lower inflammation. They stabilize the plaque and prevent plaque rupture. So there was a time in my practice where I never used statins. And now I'm back, swung the pendulum. I use them a little bit more than I did because I recognize this terrible vessel disease epidemic that we're having. And especially early on, while we're working on changing their lifestyle, repleting their nutrient deficiencies, fixing their teeth, getting rid of the infections, et cetera, we have to have them on emergency care to prevent plaque rupture and events.
But it's not necessarily a lifelong medication that once, in my opinion, once those other things are addressed,
right.
It's kind of like the way that I talk to women about hormone replacement. Sometimes you need it to start to feel better to help give you the support, but it doesn't necessarily mean you need to be it on the rest of your life. It's just to get you through that hump while we're trying to work on the actual root cause.
Right. And that's the majority, but there's some who need hormone replacement forever to feel their best. So, it's an interesting phenomenon when you're caring for patients, not for populations, and everyone is different.
Absolutely.
But I want to talk about that second test. So the first test we can do is this carotid ultrasound. The second test is a blood test. We call it the FIRE panel. So I told you that the myth is that cholesterol causes heart disease. It doesn't, unless the cholesterol is corrupted. And corrupted cholesterol is a whole nother story. It gets corrupted if it's the wrong size or shape, if it's oxidized or rusted, or if it's sugar coated. So if you have too much sugar and your hemoglobin A1C is too high, or your 2-hour glucose postprandial is too high, or your fasting sugar is too high, your cholesterol gets sticky. And when it does, it's more likely to stick. If your cholesterol is oxidized or rusted, it's like chafing it, and it's more likely to stick. If your cholesterol is the wrong size, if it's big and fluffy, a giant marshmallow tumbles through the arteries, it doesn't stick. But if it's small and mini marshmallow, those are sticky, and they collect and they stick to the arteries, and they get sucked behind the drywall to build that plaque that we can measure. So some markers that we want to look at are markers of inflammation in what we call the fire panel. And that includes myeloperoxidase, LP-PLA2, high sensitivity C-reactive protein, oxidized LDL, microalbumin creatinine ratio, and F2 isoprostane. So these are a bunch of blood and urine markers that we can use to tell the patient, is she inflamed or is she cooled off? Because if she's inflamed, we have to be a lot more aggressive about screening for that rusted cholesterol, the sugar, and all those other things. But if she's not inflamed, we got time to work. We're not in a hurry. So by doing that work ahead of time, we can identify who is at risk.
I love it.
There's another thing. No cardiovascular prevention program is complete without a dentist and a hygienist on the team. Right? So 100%. What do we know about the connection between the mouth and the heart? Many things. Well, first of all, we have to talk about breath, right? Breathing. And when your heart lacks oxygen at night because you have untreated or undertreated sleep apnea, your heart is being choked every breath because it's not getting what it needs. And so to have optimal health of your heart at night, you need to be breathing well, sleeping soundly 7 to 8 hours a night. So if you have undertreated sleep apnea, you're putting your heart at risk. We got to fix that. And sleep apnea doesn't always require a CPAP machine. I personally have very mild sleep apnea. My apnea-hypopnea index is about 7 to 10 when I lie on my back. 5 is normal, 15 is moderate. So I'm mild. So I didn't want to wear a CPAP if I could help it, but I have a dental device that I wear that's custom made, and it has a little key in it that I can advance. So over time, it's stretching and expanding my jaw and my maxilla, the top of my jaw, the bottom of my jaw, 2 pieces. And I literally tape my mouth closed at night.
Me too.
Yeah. So I tried lots of different ways. Here's a little tip. I go from the bridge of my nose under my chin, and I tape in this direction. I leave the corners of my lips open. That way I can drool. And if I have to cough, I can get it through the corner. I don't have to peel the tape off. So I tape this way. And also this problem many of us 55 and older have, we get this little black hair on the bottom of our chin. When I pull the tape off, that little black hair comes off.
Double purpose. What device are you using?
So mine is called a Vivos. It's a version of ALF. I forget what that stands for. Yeah. So
I was wondering if it was the DNA or.
It's Vivos. I think used to be called DNA. I think. So yeah.
I started with that one, and I was like, you know what? Let's just stick one in there permanently. And so that's what these silver things are.
Oh wow.
I'm so close to having them out. It's fabulous.
Yeah.
But the great part is it allows room for your tongue. So that's exactly what you're doing, is you're creating that space that we should have had.
So my tongue can move forward because they pulled 4 teeth and I didn't have room. So now they're making room for that. So, so sleep apnea and oxygen is only one way your mouth is connected to your heart. Another is the bacteria in your mouth, right? So we all know that we have a microbiome. That's not news anymore. We know that we have the number of bacteria outnumber the the cells in our body 10 to 1, right? So, and then the amount of DNA is 1,000 to 1 or something like that. So we have this huge microbiome cloud. It starts a few inches beyond our body and extends in our mouth microbiome, different than our nose microbiome, different than our throat, our GI tract, our vaginas. They're all different.
Mm-hmm.
Our mouth microbiome, though, most clearly resembles our lung microbiome. And so we have to make sure that we have a healthy mouth so that we have healthy lungs so that we can breathe. If our gut has dysbiosis in it, it's very hard to get your mouth balanced. You have to have the right pH. And sleeping with your mouth open changes your mouth pH and dries out your mouth. And one of the symptoms that we have as we approach our menopausal transition and we begin to lose our estrogen is our mucous membranes get dry, right? We talk about vaginal dryness with our women. Often in our questionnaire, do you have vaginal dryness, hot flashes, night sweats? We don't ask about oral dryness, but a dry mouth is also a symptom of estrogen deficiency. And so when you get this dry mouth, the pH shifts, and then the unfriendly bacteria begin to colonize your gums and increase the risk for periodontal disease, gingivitis. That's a problem. Mm-hmm. Also, in today's day and age, so many of us have had cavities and teeth filled. That dry mouth leads to a breakdown of those fillings, and bacteria then get underneath there, and we end up with a dental abscess. And get a dental abscess. What's the next natural progression for most dentists? A root canal, right? So what does a root canal do? It takes the filling out, drills down into the root, sucks out the pus, we hope, sometimes not always, they don't even do that, sucks out the pus, and then shoves a material called gutta percha down into the tooth root and puts a crown or a filling over the top of it. Mm-hmm. That tooth is now dead.
Mm-hmm. It's a taxidermied body part.
It's a taxidermied body part. It's a mummy. We call them zombie teeth in our office, mm-hmm. right? So you have zombie teeth now living in your mouth. They're dead, but they're surviving here, mummified in your head. 100% of root canal teeth have infection in them. It's dead tissue. It's always going to have bacteria living on it.
Well, thank you for saying 100%. People look at me like I have 5 heads.
100% of root canal teeth have bacteria on them. 100%. But how good your body's immune system is at controlling and regulating that infection will determine whether or not that root canal is going to be a problem. Mm-hmm. The problem with the dentist is that they don't recognize the problem because the problem happens not in the mouth very often. When the root canal begins to go bad and the bacteria from the root canal begin to seep out of the location of the mouth, where do they go? They go through the lymphatics and the bloodstream into other parts of the body. It is now known that up to 50% of heart attacks are caused by oral bacteria getting into the coronary artery, rupturing the vessel, and causing a blood clot. 50%.
And women, Dr. Campbell just told you that cardiovascular disease is the #1 killer of women.
Right.
And 50% of those are linked back to root canals, right? Am I reiterating?
Linked to oral bacteria.
Or oral bacteria.
Yes. And so that bacteria can sometimes come from periodontal disease, gum disease. Sometimes it comes from root canal teeth. Another thing that is unique to women that I see in root canal teeth is we do in my office thermography, thermal breast imaging, as an adjunct to mammography. A mammogram looks for breast structure after the tissue's already changed and has a different appearance on an x-ray. Thermogram looks at breast function, a heat signature of how much activity is going on in that breast. Mm-hmm. And over and over and over in my office, when we see a hot breast, we see a hot tooth on that side. And so in one study, the doctor looked at root canal teeth and breast cancer patients, and every single breast cancer patient in his study had a previous root canal. Mm-hmm. And there's actually a Chinese meridian chart that the traditional Chinese medicine acupuncture specialists have made that map out every tooth to what part of the body it goes to. Mm-hmm. And so the teeth are the heart maps to the wisdom teeth. So the wisdom teeth are the ones that are most connected to the heart. So I want to tell you a story about one of my patients who has no cardiovascular risk factors whatsoever. She is not overweight. She doesn't smoke. She exercises 5 days a week. She eats a mostly organic diet. She's a retired attorney at the age of 30. She takes care of her 4 kids. And so she has this practically perfect lifestyle, right? But on her annual exam, I do that fire panel on all my patients. And one of her markers, LPPLA2, was off the charts elevated. It's like, what the heck? Where's that coming from? I said, well, do me a favor, go back to your dentist and ask them to check your wisdom teeth. And she goes, come on, check my chart. I had my wisdom teeth out when I was a teenager. And I said, oh, all right, have them check the sockets where your wisdom teeth used to be. And she's like, what do you mean? I said, there can still be bacteria living there, especially when you were a teenager. When they pulled out a wisdom teeth, they often neglected to remove something called the periodontal ligament. That's a little connective tissue string that holds the tooth in its socket. And if they don't pull that out, it leaves a little piece of tissue, which is likely to get infected. But there's no nerve anymore. They pulled the tooth and the nerve came out with it. So you may not even feel it. So she went back to her dentist. He took an x-ray picture and he said, well, you do have a dark spot there in your jaw, but it's been that way for 10 years. I don't think it's causing a problem. And I said, I think it is causing a problem. It's making your blood work abnormal and it's increasing your risk for a heart attack. I want you to go see a second dentist. So she went to go see a second dentist who said, I think you have a dark spot on your tooth where your jaw, wisdom teeth used to be on your jaw. It's serious. We need to watch it come back in 6 months. I was like, no, you need something done. So I found a third dentist who practices what we call biological dentistry, and he had a cone beam CAT scan machine. So he cone beamed her and he said, oh my gosh, you have an abscess. So he took her to the operating room, cut open perfectly normal gum, and down in there was a whole bunch of goo and infection, which he had to scrape and scrape and scrape and scrape to get this infection cleared away. It took 6 months. I measured her blood work every 2 months. It took 6 months. It went down and down and down and finally normalized after 6 months. Woohoo, we celebrated, yay. 2 years later, LPPLA2 back up again. So I sent her back to the same third dentist that she went to. He took another cone beam CAT scan. All 4 wisdom teeth sockets had infected pockets. And so whether we stirred up something with that manipulation or whether her immune system just tanked or whatever, she had to have a second surgery with all 4 wisdom teeth sockets scraped out. And now she's doing fine 3 years later. So, but it took us 3 dentists because the first 2 were classically trained and it took the third dentist to identify the real problem and to save that lady the risk of having a heart attack.
You almost described me. Luckily, I skipped the first 2 and just went to a biological. And when they did my cone beam, the radiologist that read it actually wrote in there cavitation. That's how bad it was. Like, radiologists avoid using word. Specific terms because they don't want to be held liable for whatever, because there's a lot of dentists out there who don't believe cavitations are problematic. They think that it's fine, it's not causing any issues. But what I found, not just in myself, but in other clients that we've had that we've sent for cavitation work, those bacteria are really stealthy and they like to jump and go to other places. So it's really important when you're doing it to do systemic work at the same time to try and kill whatever is in there. And right. It took me a long time to get these down. I'm actually due for another cone beam, but I was having to do ozone injections on top of having 8 hours worth of surgery to get them all cleaned out. So thank you for bringing that up. And when I tested it, there's a test called DNA connection. Yeah. It came back that I was going to have a silent heart attack at some point because of the bacteria and what the bacteria are linked to.
Not just bacteria, viruses, fungus, amoebas.
Yep.
My DNA connections on my tooth had amoebas growing in it.
Like, oh, I didn't have that.
Right? So, and I worked with oral surgeon because I had to have one tooth pulled, my one and only root canal tooth. had to have that pulled, then I didn't quite get better the way I was supposed to. So I went to go see my dentist, who sent me to a bioenergy practitioner, where I had a bioenergy test, and it showed that I was starting to get a level 1 cavitation where my tooth had been pulled. So they recommended ozone treatments and a bunch of homeopathic imprinted materials. And now I have no symptoms, and I'm due for my follow-up cone beam and follow-up energy test next month. So yeah, so it's personal, right? And I would have never known to look for these things had I not gone to the American Academy of Oral Systemic Health, the International College of Integrative Medicine, American Academy of Environmental Medicine. We go to these conferences to learn this higher level of care that integrates medicine and dentistry together, because every single one of my patients I've had 0 heart attacks since I've started this work, except for one patient who wasn't doing what I asked her to do. So there's that. She knew it too, which is the sad part. But I've had no other heart attacks except for that one. But I've had many near misses. For example, I had a patient that he said he had sinus surgery. He called me back and he said, I hear a weird whooshing in my neck, or in the back of I hear a weird whooshing in the back of my throat where they must have done the surgery. And so I said, come in and I want to see you right now. So he came to my office and I listened. He had developed a bruit, an abnormal sound. His heartbeat that I could hear in his neck was going whoosh, whoosh, whoosh. And so I know that sound means he has a blockage. So got an emergency ultrasound, hit a 95% blockage in his neck artery. And I was like, how did you get that? Oh my gosh, I'm doing everything I'm supposed to be doing. What's going on? So he went to the OR. He was in the OR waiting room, and he called me from the emergency room waiting room. He goes, they delayed my case by 2 hours. And as I'm sitting here, I'm getting a toothache. My tooth is just throbbing. Should I tell the dentist? Should I tell my neck surgeon this, my vascular surgeon? Should I tell him about my toothache? I'm like, yes, they need to give you IV antibiotics right now, because it is probably that infected tooth that caused the disturbance in the vessel that made it suddenly fill with plaque, right? And so he had his roto-rooter surgery and he's fine now. We have avoided a stroke, but only because we were Johnny on the spot about evaluating him and treating him with a full approach, including his dentist and his vascular surgeon.
People all the time go, because I am not a proponent for antibiotics more times than not. I think they're overused, but every single time somebody is having a cavitation surgery or a root canal surgery, I 100% recommend that they get on an oral antibiotic, typically for about 10 days, just because of the cycle of bacteria. And then we can work on rebuilding everything after, but it's to avoid that translocation of the bacteria into the lymphatics, into the bloodstream, literally destroying things like this, resulting in what you just described. Right. Holy moly. Thank goodness he had you.
Yes, I hope.
Oh my gosh. So what are some other things that women really need to be cognizant of then, to oral healthcare wise, other than not mouth breathing? Because that is a huge problem. I walk in, I love people watching, and I see people doing this all the time. Mouth breathing. That is going to 100% disturb, like you said, the microbiome of the mouth, increasing your chance of cavities, increasing your chance of gingivitis, increasing your chance of periodontal disease, and the list goes on and on.
Yeah. And there's another really important one. So remember, mouths are for eating, noses are for breathing, right? So mouth should be closed all the time unless you're putting food into it. But there's a miracle mouth molecule called nitric oxide. Nitric oxide actually won the Nobel Prize. It's so important. It's a gaseous signaling molecule, and it opens and dilates your vessels. From the importance of opening and dilating vessels is maybe better known to our male watchers than our female ones, because the drug Viagra was invented when we discovered this nitric oxide pathway, because it works on that pathway. But nitric oxide is made primarily in the nose from nasal breathing. but the rate limiting enzyme that makes nitric oxide, called nitric oxide synthase, that enzyme is made by the bacteria that live in the crypts of your tongue. So you have to have a healthy tongue in order to make nitric oxide through your nose. So that nose-mouth connection is critical. And without nitric oxide, you have a tendency towards high blood pressure, cognitive decline, poor sexual function, poor bladder control. So we really need to zip our mouths closed and open our nose so that we can get nitric oxide to keep our entire body, all our mucous membranes that are served by tiny blood vessels healthy.
Isn't that crazy how the little things, because like you said, our mouths are meant for, I say, chewing, swallowing food, smiling.
Yes. Yeah, you can open your mouth to smile.
But everything else, all the breathing should be happening through the nose. And so catching this early in children is imperative too, because the sooner you can exnate a mouth breather and starting earlier on, you're breaking a bad habit from becoming problematic. And I've been mouth taping for, 2-3 years now, but I have to mouth tape because no matter what, I start breathing through my nose and it's like a reflex. As soon as I go into my REM sleep, mouth opens and I start mouth breathing again. So I don't think I'll ever be able to not tape my mouth, but that's okay.
Right. It's a small price to pay for all the benefits that you get for nasal breathing through the night, right? Mm-hmm. Not to mention, before we learned about mouth taping, those people often ended up on CPAP. Mm-hmm. And now you can just tape your mouth and carry that little thing in your suitcase instead of the CPAP machine when you travel.
Oh my gosh. One time I was traveling for work and I forgot my mouth tape and I didn't realize it till it was like ready for bed. And I was like, I'm not going to the drugstore to get anything. So I used a Band-Aid.
Yeah.
Didn't work as well.
But it kind of works.
It's okay in a pinch, but my husband.
I think I like the vertical taping rather than the horizontal. Band-Aids do not work on horizontal taping at all.
Yeah, I'm a horizontal taper. Maybe I'll try the up and down, but I think I would still breathe through the corners of my mouth if I did that.
Yeah, just try it and see.
So
the secret is to get it under your chin so it keeps your chin closed, not just your lip.
That I wasn't doing. What type of mouth tape do you use?
I use micropore.
Okay.
Yeah, so it's a paper tape. It goes on, and I also fold the edges of the top and the bottom so it's much easier to peel off. Otherwise, you kind of have to pick at the corner to get it off. If you fold it before you stick it, then it's easy to pull down.
Oh, that's a nice.
So I use a 2-inch wide micropore tape.
Do you just get that from the pharmacy?
Yep. Mm-hmm. Well, I'm a doctor. I order it through McKesson, my medical supply company.
I know. I do the same thing, but I use 3M sensitive, and that is cheapest on Amazon, guys. Don't go to a pharmacy. Just order it off Amazon. Any other tips and tricks that you want women to really understand the connection between mouth body? Yeah,
TMJ. So that's something I want to talk about briefly. If your jaw pops, clicks, or locks when you chew, you have some form of temporal mandibular joint dysfunction. The TM joint is where your mandible, your jawbone plugs into your skull, and there's a little disc that separates those two so that it can open and close smoothly. Interestingly, I had a concussion. I was rear-ended by a semi-truck 4 years ago, totaled my car. It was ugly. I had a concussion. It was terrible. What I didn't realize, what I learned through that experience, was that very often if you've hit your head hard enough to cause a concussion, you likely have a cervical spine injury as well. And I did, and I didn't know it. So when we finally got that evaluated, and I realized how much tension and dysfunction I had in the fascia of my neck, that tension pulls all the way around your scalp into your jaw and literally was pulling my jaw out of alignment. I never had a TMJ problem prior to that. So I ended up seeing a craniosacral massage therapist to get my fascia all rearranged and my jaw smooth and my skull bones back in alignment and get that strain off my neck and shoulders. And it was miraculous, helped my headaches better than anything I'd done to date. But in my investigation through that, I learned that the temporal mandibular joint has estrogen receptors. And so as we begin to age, and it's funny because I had that accident and I was still cycling. The month after that was my very last period ever. So it pushed me into menopause. Now I was 55. So, it was going into my 56th birthday. So it was time to stop my periods, but I blamed a lot of what was happening to me, temperature dysregulation and jaw creaking. I blamed that all on menopause. I blamed it all on an accident when in reality it was probably menopausal. And as I tweaked my hormones and got a little higher estrogen, a lot of that creaking and popping in my jaw went away.
Crazy.
So, it's almost never one thing, right? It's always layer upon layer upon layer. So for me, it was a root canal tooth that was smoldering that I didn't know at the time. It was a TM joint problem that I didn't really have, but was triggered by an accident combined with menopause. So you got to fix all of those root causes. And when you do, now I have no symptoms. I don't take any medicine. So yeah, blessings.
And that's right? Where that integrative approach comes in, working with different practitioners with different skill sets to really address all of the factors. Because I don't know about you, but I've never once seen it be one thing and one thing only causing XYZ symptom.
Right.
That'd be too easy.
Too easy. We wouldn't have to go to school for how many years to figure out one thing.
Oh, that would be so easy. Not to mention if results and changes happen like this, like overnight, like we want them to, that too would just be too easy. So
not like take 9 months to grow a baby. Takes a lot of time to adjust the tissues of any body part that's been injured.
Mm-hmm. So do you have any finishing thoughts on, cardiovascular disease, the mouth, and maybe some pointers that women can implement today to avoid long-term or potentially life-threatening outcomes?
Right. So yeah, a couple, I think. Number one, take good care of your mouth and your teeth, but don't sterilize your mouth. It's not supposed to be a sterile cavity, right? Don't rinse with alcohol, Listerine type mouthwashes unless it's for a very short period of time on the prescription of your dentist, because those types of mouthwashes eradicate the healthy, friendly bacteria that are supposed to live there, right? Cavemen had tons of plaque on their teeth, but they didn't have periodontal disease. They didn't have cavities, but they had plaque. So bacteria are not bad. Plaque is not necessarily bad, but bad bacteria do really bad things. And so we want to have a careful assessment. Choose your doctor and your dentist wisely and make sure that they talk to each other. If your dentist doesn't send reports to your doctor, ask them to. If your doctor doesn't send reports to your dentist, ask them to. Because by you as a patient helping to instill interdisciplinary collaboration, the doctors are going to want to go to the dentist conference and the dentists are going to want to go to the doctor's conferences, and you'll get better care. So be an advocate for that. Another thing that I would say is your toothpaste and toothbrush matter. I am not a big fan of fluoride. I think that there is a role occasionally for topically applied fluoride by the dentist, but for the most part, most of us shouldn't be using fluoride. It's toxic to our thyroid gland because it competes with iodine. Our breast, our thyroid, and our ovaries use the most iodine. If we're blocking that by ingesting fluoride, it's not a good strategy for any of those organs. So choose your toothpaste fluoride-free and free of sodium lauryl sulfate, SLS, highly irritating to the gum tissues. So I like doTERRA has a nice toothpaste. I have all these different colors of toothpaste on my dresser. I'm trying to remember all the names of them.
Have you heard of Revitin before?
Yeah, Revitin, that's the orange one.
Oh,
yeah,
yep.
Revitin's one of the ones that I use. That's Jerry Turritola's toothpaste. That's a really nice one. So, so choose your toothpaste, your toothbrush wisely. Don't over clean your teeth. Flossing is good, especially if you have material between your teeth. If they're separated enough to catch food, get rid of those food particles. I am a fan of a water pick-like device. I use one called a HydroFloss. I think it really does make a difference. It always sort of blows my mind after I've brushed and flossed and rinsed, and then I got at the HydroFloss and I look at what came out in the sink. I'm like, ew, that would have been left there if I hadn't been HydroFlossing. That's gross.
100%, especially with dental implants, like my dental device. You can't clean it well enough with anything other than that water pick.
Right. Take care of your heart. And that, I mean that figuratively as well as literally. You know, the number one predictor of a lifespan over 100 is connectedness to your community. So we want to make sure we don't forget to stay connected, our heart to their heart. That is an important part of wellness for everybody. Don't be lonely. If you're feeling disconnected and lonely, reach out. There's somebody there that loves you, that will help you through this stage. But also, do the investigation. Have a coronary, if you're over 40 or so, have a coronary artery calcium score. That's an X-ray test, CAT scan you have done at the hospital. Usually almost every hospital in Georgia will do them for under $150. It's not an expensive test. It's one time, maybe once every 10 years at the most, to look for calcium. If you have calcium in your coronary arteries, you have atherosclerosis. You are now a heart patient. You should have zero calcium. And so if you're a heart patient, now you need to find somebody who can aggressively help you to reverse your risk for cardiovascular disease. It's the number one killer of women.
Wow. Women, please start looking at your mouth and your, you know, day-to-day care. Not to mention, I love that you said connection and making sure that we are connected. So being part of a tribe is so important for women. It's important to men too, but it's really important to women to have that connection. So find a group or join the Women in Wellness Facebook page, start connections, start talking to like-minded individuals, support and love one another. It will make a huge difference. Wow. Last thing before we sign off, because I have a feeling I'm going to have to have you back on so we can talk maybe about the mouth and how it affects like sex hormones, or the mouth and how it affects thyroid hormone. Because I honestly could talk about the connection for days and not lose things to talk about because of how intricate and how involved they are. But I'd like to end the podcast by asking just a few fun questions so that all of the Women in Wellness tribe can get to know you a little better. So don't think too hard about this. What is your favorite beverage?
We call it bubble water, sparkling water. We call it bubble water in my house. We'll sometimes put a shot of pomegranate juice in it, a little tablespoon or two. So we call it bubble with a shot. That's our number one drink in our house.
What kind of bubble water do you drink?
We usually drink LaCroix, but I like Perrier if I can get it in a glass bottle. They kind of switched to plastic and it's harder to find.
I know. I was very disappointed when I thought I was buying a case of glass and it ended up being a case of plastic. Live and learn. What's your favorite food?
Well, my favorite food, I'm ashamed to admit my favorite food is a potato. It's epigenetic. See, my relatives come from Poland and Lithuania, where it's a root vegetable countries. And any way you can shape and make a potato, that's my favorite food.
Oh gosh, growing up with Polish food, it was part of every meal, I'm pretty sure, in some way, shape, or form.
I know. I don't eat them very often anymore because probably ancestrally the potatoes were somewhat different than a starchy white Idaho potato is today. Now there's such a high glycemic index. They're just a really harsh food to consume. So we try to limit it, not very often. But I told you I just turned 60 for my birthday. And so I'll send you the picture of it. My birthday dessert that my girls made for me was a bowl of French fries with a candle in it.
Oh, how funny. Honestly, though, a good French fry cooked in good oil is my Achilles. Yeah, I cannot say no.
Girl.
Oh, but I don't have that often because finding a good French fry cooked in good oil is slim unless you do it yourself. So
yes.
What is your favorite pick-me-up go-to song when you got to get like pumped up?
Trying to remember the name of it. Going out tonight, feeling kind of bright, gonna let it all happen.
Oh, Shania Twain?
Shania Twain. Feel like a woman. There you go.
There you go. Leave it to the Canadian to know.
And I actually sang it well enough for you to know what it was. That's even better.
Good job.
Yeah.
It's crazy. One of my superpowers is knowing songs after hearing them only like 2-3 times.
Yeah.
And I joke that if like every seminar had music behind it, I would never forget a dang thing. Like I would be a freaking computer, but doesn't work that way. What is on your bedside night table?
I have a Bible, a nightstand, last year's taxes, and 2 supplements. One is called Adrenavive, and the other is called Indol 3-Carbinol. So
Very nice.
I take at night. They're next to my nightstand.
Help with estrogen. Very wonderful. And support those adrenals. Any last fleeting thoughts that you would like to share with the listeners before I thank you very much for being with me today?
I just think they need to stay in your tribe because you share so much amazing information from so many different sources that are expert in their field. So if they hang with you, they'll be better off for it.
Oh, thank you. And again, I would love to have you come back on so we can geek out on the mouth and thyroid, or mouth and sex hormones, or mouth and brain dementia, Alzheimer's, like the list goes on and on about what we can talk about. So thank you so much. Where can my viewers find you to follow you and get more information?
So Dr. Ellie Campbell like the soup. So don't forget that. Not related, unfortunately, but you can remember it. So CampbellFamilyMedicine.com is our website. CampbellFamilyMedicine.com is our Facebook page. At our website, we have a link to the Instagram and Twitter, which frankly, I don't use, but my staff does for me. So, and we are in the middle of a website upgrade. So it's ticky and tricky right now. And if it says it's been corrupted or hacked, don't go there. Wait until tomorrow or the next day. We should have it up and running soon.
Awesome. Well, thank you so much. You have been just a plethora of information, and I learned some things today that I didn't even know about that I'm going to dive deeper into. So thank you for everything that you do.
You're so welcome. My honor. My heart to yours.
Absolutely. All right, ladies, take care of your mouth, take care of your heart, and make sure you get connected. I hope you enjoyed this episode of Women in Wellness as much as I did. If you did, please leave a review and a rating so that others can also benefit from the information being shared. Make sure to subscribe as new content is released on Women in Wellness Wednesdays. And if you want to connect with us, go online to womeninwellness.com. That's women, the letter N, wellness.com. I look forward to seeing you next time.